March is Colorectal Cancer Awareness Month, 4 weeks dedicated to talking about this disease, promoting early detection, encouraging screenings, especially because while colon cancer rates are down among older adults, they're up for the younger crowd, people between 25 and 49. Dr. Evan Fitz specializes in colon and rectal surgery at Franciscan Health. Thank you so much for being here.
No, thanks for having me.
So we've all talked about the fact that the earlier we can detect this, the better chances of a positive outcome. What's the best way to do that?
So there are a lot of screening modalities for colon and rectal cancer. The one that everyone's mostly heard of is colonoscopy. And one of the important facts about colonoscopy is where we used to do it at age 50. Now for normal risk people, we're doing it at age 45 because we found, as you said, that more and more younger people are being diagnosed with colorectal cancer, and it's very important to find it early to have the best chance of not only a good outcome, but cure. Other modalities are the Cologuard test, FIT test, that basically look for blood in the stool, but by and large, one of the best tests I think that's still out there, despite some opposition from patients and preps, is the colonoscopy, which I really think is well tolerated and allows us to both diagnose and treat some early cancers and polyps before they can ever become cancers.
So let's say it is cancer. I've been diagnosed. What are my treatment options?
Sure. So the first step, whenever we bring patients in, we bring them with their families and we want to lay out all the options, and everyone hears that word cancer and they immediately, their mind jumps to a bad place. But I initially reassure them because colon cancer is really treatable, particularly when we find it early. So the first step is staging. We want to know exactly everything we can know about this tumor before we start going in guns blazing trying to treat it. So once we know that the tumor is confined to the colon itself, then one of the best treatment options is surgery. We can often do a minimally invasive or robotic operation where we take out a portion of the colon, but put it back together and allow the patient to recover and go on with their lives and hopefully have a cure.
5 years is the cure mark.
That's usually what we say. We say 5-year survival rate is kind of what we look at as cure, but we have good ideas of when it's been a year or two and there's absolutely no signs of it coming back. We start to feel real confident, but we don't put our heads in the sand and just say, yep, we're great. We keep following and make sure. Because again, similarly, if something's coming back, we want to know as early as we possibly can, so then we can treat it.
And what does that follow-up look like if you've got detection that this may be coming back?
So we basically, with our colon cancer patients, when we've taken care of them and whether they get chemotherapy or surgery, once we feel like we've taken care of it as much as we can, we follow them with lab work. Every couple of months, every 6 months, we start spreading it out after it's been a year. We repeat a colonoscopy at 1 year, and then we get CT scans. So basically imaging, lab work, and physical exam and colonoscopies.
We guys typically, it's the way we're wired, I guess, put things off, don't like to go to the doctor. What is your message, though, to men in particular when it comes to this area?
It's something that we all do. Everybody poops, nobody wants to talk about it, but sometimes guys can talk about that a little bit easier, but certainly nobody wants to go through a colonoscopy. And I think when it comes to my messaging for patients, it's important to just tell them, there's a prep, but then you're gonna have a nice nap, and then you're gonna be able to sleep easy that night. And it's very important because not only are, as you mentioned before, colorectal cancer rates increasing in younger people, in fact, by 2030, colon cancer is going to be the #1 killer of cancer-related causes deaths of people from 20 to 49 years old. Wow. So it's going to overtake multiple other cancers that, we thought that were only going on in younger people, but now colon cancer is one of those. And unfortunately, men have a higher incidence of colorectal cancer than women do. So for basically treatment, it's really important to get men in.
All right, Dr. Evan Fitz with Franciscan Health, thank you so much for being here.
No problem. Thanks for having me.